Confirming patient details. So for example, a patient is coming in for a biopsy. This patient is a 12-year-old cattle dog. They have presented with a lump on the abdomen. This lump has grown significantly in the past month and has gotten to a size and has become a concern to the owners and the veterinarian. They will be getting put under anaesthetic, general anaesthetic, and the lump is getting removed and sent off for testing to check whether it is cancerous or not. The cattle dog is a male, desexed, 12 years of age, and has no other conditions known, and no other known conditions. Other examples, say a patient is coming in for an ultrasound. So Millie is coming in for an ultrasound. Millie is 4 years old and is pregnant, last bred on the 11th of August 2019. Millie's owner has elected for an ultrasound to confirm pregnancy as she has put on weight. And since last being bred with a male, as said, she's a 4-year-old. She's an Australian Kelpie, clearly undesexed, being pregnant, and has no known conditions. She's fully vaccinated and everything ready for the procedure. And lastly, for an intra-articular joint injections, commonly used with suspected arthritis. So we have a 14-year-old dog come in, name is Roxy. She's a Corgi Cross. She has suspected arthritis in her left elbow, and is a intra-articular joint injection is being performed to confirm the arthritis. Intra-articular joint injections are also commonly used in horses. So you would confirm their details the same way. So species is equine, male or female, how old they are, their history, the reason they are getting an intra-articular joint injection, and this is all told to your veterinarian upon their admission for the procedure.
One's a smaller one, 5.5, 6, 5. It's still on here too. No, can go. Check out the juice.
So I'm not taking that laptop if I should do it, because it's such an old system. No, it's an old system. It's not letting me go with the things. And so I'm going to have to one of those things going to convert. It's the second hand, also straight on these ones. And the other thing I think we should do then is it's probably a little bit.
You just put crumble levels here. No, shit. So.
Are we near it? Ready?
Just do it. No, you just put cotton on it.
And also, bubble wrap, just on the pads, but you've got to do your ties around it. I might have some comfort. Just clip around there too. No, that's good.
Yeah, we look down there.
I'm going to look at material, just as important. Okay, we've got sugar. Thank you. Size.
We've got between 5 and 6 now.
I'm going to that one. I know. It's all right. Yes. Take that, please. Too big. That's too big. Thank you.
Yep, no worries. So, everything will.
Biopsies are most commonly performed under general anaesthetic, depending on the size of the lump. Therefore, you will require an anaesthetic machine, surgical kits, ET tubes, all equipment like your iodine, your pink spray, Chlorhex for skin prep, clippers, suture material, etc. Patients are positioned depending on the location of the lump. For example, if the lump is on their sides, like left or right side, they'll be in left or right lateral recumbency. If the position is abdominal, they'll be in dorsal recumbency. And if the lump is positioned on the back, they will be positioned on their belly in sternal recumbency. 2 to 3 centimeter border is clipped around the lump, as well as the lump itself is clipped. This is to make sure to remove all hair from the surgical site or area before removal. The skin is prepped as shown in the video. Other equipment required for a biopsy include a sterile blade, sterile collection container, either just an empty one or a sterile container with 10% neutral buffered formalin solution, ice packs, and a postage bag for sending off the sample to the pathology lab for testing, as the clinic I work at doesn't do any in-house testing of lumps or biopsies. Okay, so for injecting into the knee, you're going to position the knee at a 45-degree angle in here. So you don't want it 90 degrees, about 45. For the elbow, I think that patient needs to be on their back. Good girl. On the back. Good girl. And you can inject under here or at the front. so dorsal recumbency is best. Injecting into the hip, you want the patient in lateral recumbency, and the femur must be parallel to the floor. And someone's going to pull the hip or the leg away from the paw away from the patient as if they were to be standing, so like this, and your patient in lateral recumbency for injecting into the hip joint. For intra-articular joint injections into the shoulder, you're going to do the same. Patient in lateral recumbency, the leg parallel to the floor, and someone pulling the paw away from the body. Equipment required for intra-articular joint injection includes sterile needles, sizes ranging from 18 gauge to 23 gauge, depending on the patient's size and the area in which you are doing the injection. Toy breeds can use an 18 gauge or a 22 gauge 1.5 inch needle, and for large breeds use a 23 gauge 1 inch needle. You'll need sterile syringes of different sizes depending on the dosage rate of your drug / medication of choice, and you'll need 2 sterile syringes, one for injecting into the area and making sure you're in the correct area, and one with your drug of choice. Drugs of choice can be anything from hyaluronic acid or etc. You'll also need clippers, metho, swabs, cotton wool, sterile gloves, sterile drape if procedure is being performed under general anaesthetic, etc. Steps for performing intra-articular joint injection include: so you're going to begin by clipping the joint / injection site and wiping with metho about 2 to 3 times. 2, you're going to position the patient and the joint depending on the area of injection, whether that's the knee, the hip, the elbow, what are some other areas? Or the shoulder. Then you're going to inject the needle slowly into the joint space, confirming you are in the correct position by withdrawing some synovial fluid. Then you're going to replace the syringe with the drug-filled syringe and begin to inject until you begin to feel back pressure inside the joint, and then you're going to remove the needle. Positioning of the patient for different injections includes, so if you're for the knee, injecting in the knee, you'll lay the patient in lateral recumbency and bend the knee to a 45-degree angle. Elbow is dorsal recumbency. Place a fulcrum under the elbow and pull downwards to do that. Hip, lateral recumbency, the femur should be parallel to the floor, pulling the paw away from the patient's body as shown in the video, not forward or backwards but straight down as if they were standing. This is to open up the joint space. This is similar to the shoulder, similar as you would with the shoulder. So lateral recumbency, leg parallel to the floor, pulling the leg away from the body to open up the joint space. Equipment required to perform an ultrasound includes ultrasound machine, transducer, ultrasound transmission gel, sedation of choice with correct size sterile needle and syringes. This is only required if the patient won't lay still or is nervous or aggressive and requires sedation. You'll require a sterile transducer cover if your clinic uses one. We don't. You'll require clippers, and that's about it. To set up the ultrasound machine, you're going to plug in the machine to the wall, connect the transducer to the machine and making sure it's locked in place. Switch on the machine at the wall and then on the machine itself and allow it to warm up. For an ultrasound, patients can be positioned in a number of different positions. The chosen position will depend on the patient's demeanour or whether they are sedated or not. They can either be in lateral recumbency, dorsal recumbency, or even standing.